ageing population and huge advances in healthcare mean many Australians face a prolonged and costly death. Now, several Australian states are contemplating voluntary euthanasia bills that will legalise mercy killings of the terminally ill. I'm Drew Ambrose. On this edition of 101 East, we ask if voluntary euthanasia could be the solution for Australians asking for the right to die with dignity.
In 1996, Australia's Northern Territory became the first place in the world to legalise voluntary euthanasia, essentially allowing doctors to prescribe suicide to their terminally ill patients. But after 9 months, the Australian federal government repealed the law, and assisting suicide was once again a serious crime. Today, Australians enjoy one of the highest life expectancy rates in the world. But advances in health technology that keep people alive longer don't necessarily give them quality of life.
I get too bad and I can't do nothing about it, and I just got to lay there like a zombie. I want to go when I want to go.
Many Australians who fear the prospect of a bleak, medicalised and drawn-out death are once again thinking that voluntary euthanasia might be the answer. And several state governments are now considering the option. It's a crime in Australia, taboo in many parts of the world, and a political and moral minefield. But poll after poll shows the majority of Australians want voluntary euthanasia legalised. While politicians around the country debate the issue, on the Gold Coast, people are taking matters into their own hands by learning how to end their lives when they no longer feel they're worth living. In Australia, the Gold Coast is referred to as God's waiting room for its higher than average population of retirees. Today they're out in force at a local community centre as they prepare to learn the best and most painless way to kill themselves.
You just go to the cupboard where you put this drug that you'd obtained some years back, open the cupboard, drink it down and you'll die.
Dr. Philip Nitschke is the head of euthanasia advocacy group Exit International and the first doctor in the world to legally kill his own patient.
I've never seen anyone drink the contents of a bottle like that and survive.
In 1996, Dr. Nitschke made world headlines by assisting in the suicide of Robert Dent under the full protection of the Northern Territory's new euthanasia laws. These days, he's forced to work on the fringes of the law. While suicide is not a crime in Australia, anyone assisting a suicide can face a lengthy jail term. Dr. Nitschke is throwing down the gauntlet to the authorities by running suicide workshops for the elderly and the infirm.
And while we're on dangerous gases, I should mention, by way of completion, the very cheap and nasty method, which is known as the detergent death. Here, for the pricely sum of $10, you can come back with all of the ingredients for detergent suicide. Very effective, but dangerous to everyone else, and of course it stinks. The question is always the same that's asked in the polls. If you're suffering, no hope of recovery, do you think you should be able to have access to lawful help from a doctor to die? 80% will say yes, but that still hasn't translated at this point in time to legislative change.
To avoid prosecution, Dr. Nitschke provides only advice on how people can take their own lives. But today he's also selling some new do-it-yourself suicide equipment.
This is a nitrogen cylinder. When used in a particular way with an exit bag, you would be able to end your own life in a few minutes peacefully, reliably, it doesn't fail.
His system uses nitrogen canisters normally associated with brewing beer and a special head covering that Exit members make at home.
Well, this method of bag making is very simple. We've chosen a large size oven bag, mainly because that fits all size heads. If you want to look nice, you better go and get your hair done because this does mess your hair up.
It's not a mechanical obstruction of breathing like hanging or head under water or pillow pushed into someone's face where you mechanically can't breathe. They are terrifying deaths. There's a precipitous drop in the oxygen level and you faint immediately, and you'll die very shortly thereafter, but you're deeply unconscious.
You're a very courageous man.
Oh, really? Now, exit members are generally elderly. The average age of our membership is 75. Mostly they're people that simply know that they're not always going to be well, and they want to know what their choices are should their circumstances deteriorate. And so they come along wanting to know what their options might be if their situation were to worsen or if they were to become ill in the future.
People in my age group want to be able to digress. Dying doesn't scare me at all, but living and not being able to do things that I want to do, that does scare me.
I've got scoliosis, osteoarthritis, osteoporosis, fibromyalgia, arachnoiditis, and a few others. So it's going to be a painful death.
There's no way I'm going into a nursing home where I'm lying there like a vegetable. When a certain time comes in my life and I think I can't handle it anymore, I'm certainly going to make sure that that's the way I go. I'm not going to burden my children, I'm not going into a nursing home.
Paul Russell is the founder of an anti-euthanasia organisation called HOPE and an active member of the Right to Life movement.
We have a significant problem in youth suicide in Australia, and I really wonder at this terrible mixed message about, we're trying to stop young people from suiciding, but at the same time we're actually willing to dispose of people at the end of life. That is a very, very mixed message, and I think it's a very dangerous mixed message.
Paul has upped the stakes in an ongoing battle with Dr. Nitschke. He reported Philip to the Australian Medical Board in an attempt to have him deregistered as a doctor and pronounced unfit to practice medicine.
Why did I do it? Principally because I saw it as a great issue of public safety. There are no guarantees about who buys these kits. We just don't know what happens when people access these things and what they actually use them for and whom they use them upon.
The term euthanasia is derived from the Greek word meaning a good death. While the Australian public debates what that means for them, Dr. Philip Nitschke continues a campaign of civil disobedience, informing Australians of their end-of-life choices while being careful to stay on the right side of the law. Terminally ill patients may no longer need to sidestep the law if they want to end their own lives. In Tasmania, Parliament is responding to public pressure, and the island state could be on the verge of legalising voluntary euthanasia.
We are actually a very progressive state. 80% is an overwhelming level of community support, and it really makes the argument that it's time that Parliament's caught up with community opinion on this issue.
Nick McKim is the leader of the Tasmanian Greens Party and the co-sponsor of a voluntary euthanasia bill currently making its way through the state's parliamentary process.
I think that the law has to catch up with what we know is occurring in palliative care wards right around Australia as we speak, which is that people are being euthanased, sometimes without their permission, but often with their permission, without legal frameworks or safeguards in place to make sure that it's being done appropriately.
Pro-euthanasia groups are confident the Tasmanian Parliament will legalise voluntary euthanasia within the next 12 months.
Mr. Speaker, it is disappointing and frustrating.
It's no longer an issue on the political fringe, and the proposed legislation has the full backing of State Premier Laura Giddings.
People will have the choice. If people don't want to use this framework, then they simply can choose not to use it. Under our models, doctors will not be able to sort of hawk or sell voluntary assisted dying to patients. It would have to be raised in the first instance by patients. We want to make sure it's truly voluntary, but we want to make sure that to the best of our capacity we can reduce the kind of unnecessary suffering and the unnecessary loss of dignity which tragically so many Australians currently face towards the end of their lives.
Well, a good death for me would be to be surrounded by family and friends, preferably somebody holding my hand.
For some it might mean doing the ultimate bucket list and dying satisfied you've done everything you wanted to do in life.
A good death is a death whereby we have a level of control over the timing of our death.
I think to die of a heart attack, something like that, at a ripe old age when I was doing something that I enjoyed doing would be a good way to go.